I'm Dr. Mike LeNoir, and this is the Wellness Watch. Good health, and welcome to today's edition of Welcome Watch. I'm your host, Dr. Mike LeNoir. Happy holidays to all of you. And we take advantage of the opportunity to talk to you about holiday safety. Before we get to that, though, we want to discuss an infection, which we almost forgot about in the midst of the COVID-19 epidemic, and that is flu. Each year about this time, flu season begins, and it's already begun. It seems to be especially active among young people. You might be surprised to know that each year between 30 and 40,000 people die from the flu, and it disproportionately impacts African Americans. So let's start our program with a detailed discussion about influenza with some experts. To discuss this, we have members of the allergy section of the National Medical Association. Dr. Dorothy Russ, she currently serves as the medical director of the Jacksonville location of AIDS Health Fair Foundation. Our other guest is Dr. Lakeisha Wright. She's a board-certified allergist. One of the problems that I'm seeing as a primary care physician who has a specialty is the difficulty for parents and even adults to tell when they might have the regular viral infection, the flu, or COVID-19. And of course, they're most concerned about COVID-19.
I know initially in the pandemic, we thought that if you tested positive for strep or for the flu, that automatically meant you couldn't have COVID. Now we know that you can have multiple comorbidities and multiple illnesses at the same time. Testing is important with a lot of these things, especially with the flu. Time is of the utmost importance when it comes to treatment. Here in Florida, we have kind of come down off of our curve. Hopefully we'll stay there after the holidays, but it's important to make sure that we get treatment right away. We do have resources for monoclonal antibodies for patients that we suspect have COVID, and similarly making sure that we get patients started on Tamiflu early if they have flu symptoms.
But Dr. Wright, what happens here in the Bay Area is that the school sends them home because their nose is running, they have a little diarrhea, and there really doesn't seem to be any standard by which they make the judgment about whether they think it's COVID or whether they think it's not. They just want them out of the school and to get the test. Some of my children have been tested 4 times in the last 4 weeks for different symptoms. Is there any way to do it, or are we just kind of stuck with this until everybody gets vaccinated?
I think, it is a tough situation, but we do need to increase those vaccination rates. And I think that would help out. And I think that we can, develop some, policies and some protocols to, try to help distinguish a URI or regular sort of common cold versus COVID, and the symptoms overlap. So it's very hard. And as Dr. Russ mentioned, it's really important to get tested. But then we also have to have, practices, because we want to, make sure that we minimize the amount of time that, children are, out of the school. And we want to make sure that we can, safely have them in the classroom, and we need protocols to help us do that.
Yeah, I think this is going to be a problem for quite some time. So let's talk a little bit about the flu. I never know when it's flu season. I'm tempted to get my flu shot now in May, because I didn't know every time I look up, the flu season's already started before I've got the things that I need. When actually is the flu season?
Absolutely. So the flu season runs in the United States from early fall to the winter, typically peaking around December to about February. But over the past few years, you're right, we've definitely had outliers. I've had flu cases as early as August and as late as June, which pretty much consists of the whole year. For me, my rule of thumb is to always make sure that I'm getting my flu shot and my son's flu shot by October 15th. That way it has time for the antibodies to build and to make sure that by the time we've hit that peak in December that we're protected. I like to break things down for my patients, and I discuss viruses, and I say they're like families and we have cousins, and that's how we talk about it. So you have adenovirus and rhinovirus and the influenza virus. Those are all different families, as well as coronavirus. And then once you get into the families, you have different strains, which would be influenza A or influenza B. I like to call them cousins. And then you have SARS-CoV-2, which of course is the virus that causes COVID, compared to the SARS virus that we saw in the early 2000s.
Would you like to comment on that, Dr. Roll?
No, I agree. I think it's really important for people to understand that there are sort of different versions of the virus or strains, and then there are different viruses, families, as Dr. Russ mentioned.
One of the things that most of my patients ask me is, what is a virus and why is it so deadly?
Yeah, so a virus, I like to explain it to patients as something that's sort of coming in and trying to invade your system. And we like to think of it as your immune system can help sort of fight and get rid of the invader, which is the virus. And so you can think of viruses as creating a lot of inflammation. Right now, we're talking about influenza, we were talking about COVID, and you can get a lot of upper respiratory or infection in the lungs that's associated with inflammation. And so really a virus is an invader, and your body has to be able to fight it. And part of that fight that the immune system puts up is developing antibodies. And that's where, vaccines come in, because they can help us fight off viruses because they're helping us build up those antibodies.
There are a lot of people a lot of families who, before the COVID virus issue, were hesitant about getting the flu vaccine. And there are a lot of myths about the flu vaccine as there are about the COVID vaccine. Let's deal with some of those. First of all, let's talk about and I don't know how many adults, intelligent adults, tell me this. Every time I get the flu vaccine, I get the flu. Does the flu vaccine give you the flu?
Absolutely, unequivocally not. There are not a lot of 100% guarantees that we can give in medicine. A lot of times it's benefit risk ratios and analyses, but without a doubt, the flu vaccine does not give the flu, and it's for one simple reason: it's not a live virus. There are no there are particles of inactivated flu vac, but it's not active. I'm sorry. Can we do that one again?
Sure, of course.
Sorry, I got so passionate about it.
Let me just ask the question again. Just like the coronavirus, there are a lot of myths about the flu virus that people use to keep from getting it. And in fact, before we in California mandated that everybody get vaccinated or that the flu be part of that process, there was the same hesitancy that we saw with the coronavirus that we're seeing. One of the myths is that getting the flu vaccine, how many of my own friends, every time I get the flu vaccine, I get the flu. That vaccine gave me that flu. What about that, Dr. Russ?
Absolutely, unequivocally, you cannot get the flu from the flu vaccine. There are not a lot of 100% guarantees that we can make in medicine, but this is definitely one of them. The flu vaccine does not come from a live virus. You cannot get it from the flu vaccine. What typically happens is, again, cold and flu season overlap. So you're in the winter time. There are a lot of other viruses circulating. You get that virus as soon as you've had the flu vaccine, and in your mind, you associate it with being due to the flu vaccine. But again, because it is not a live vaccine, you cannot get the flu from the flu vaccine.
Okay, another one is that, I know 4 people died from getting the flu vaccine. How common are side effects like, and certainly death is obviously the ultimate side effect, but how common are side effects with the flu, and what are they likely to be, Dr. Wright?
Now, you can get mild, side effects, such as, some redness at the site in which you're injected, some soreness in that arm that's injected. And that's, pretty common. But it's very, very rare to have an allergic reaction, severe allergic reaction to the flu. So these other reactions are very, very rare, and more commonly you can get the soreness in your arm. Now, one of the things that Dr. Russ did mention as well is people are saying, well, every time I get the flu vaccine, I can get the flu from it. And so, one side effect that you can get, or a compilation of side effects, include, you can feel sometimes headache or your muscles can ache. And so sometimes you feel that way, or perhaps even a mild fever. Sometimes that is a sign that your immune system is working. So it's learning how to mount that immune system response, because that's exactly what you want. You want the protection. If your body were to come in contact with the flu, you want the flu to be able to fight it. So sometimes patients can mistake that for, oh, I'm actually getting the flu. No, it's actually your immune system learning how to fight.
Our special guest today, Dr. Lakeisha Wright, Dr. Dory Russ. We're in the Wellness Watch program. We're talking about the importance of flu vaccine, it's kind of second rate now that the COVID vaccine has taken over. But now, and even prior to this, influenza had a devastating effect in our community. We've given you some statistics. What about pregnant women? We're just starting to recognize that those of us who are dealing with, infants and children, pregnant mothers, that it's important for pregnant mothers to get most vaccines. What about the flu?
Absolutely. So when you're thinking about pregnancy, you're in an immunocompromised state. So again, you want all the protection you can get, but then also you have the physiologic changes of pregnancy as well. So a patient who is pregnant and gets the flu is at greater risk for actually being admitted to the hospital, possibly being intubated and dying. Compare that to the 5 minutes it takes to get the shot to get that protection. It's definitely recommended.
Yeah, and we're already dealing, Dr. Wright, aren't we, with an increase in maternal mortality among African-American women. And so consequently, we really need to take every step we can take. Wouldn't you say?
Yes, I think it's very important. It's very important to understand why pregnant women are so vulnerable, and of course they're carrying their baby, and that takes a large toll on the body, and the immune system is compromised. So again, with that flu vaccine, you're giving your body the chance to be able to fight, to develop those antibodies, and particularly in pregnancy, it is very important to have those antibodies develop, and it's very important to get vaccinated to get the appropriate antibodies.
What are there some people who shouldn't get the vaccine?
Right. The most common reason to not get a flu vaccine would be if you have a history of Guillain-Barré disease. Guillain-Barré disease is a disease that affects the nervous system. It's been in the news a lot this year because there were some patients who received a COVID-19 vaccine and subsequently developed Guillain-Barré. Typically, those were men in their late 40s or early 50s. So again, if you had a history of Guillain-Barré, that would definitely be a discussion to have with your healthcare provider about the risk-benefit analysis of receiving a flu vaccine.
One of the things that in my introduction is that we're all members of the allergy section of the National Medical Association. And we'll talk a little bit about that toward the end of our program. But as allergists, we're always concerned about the impact of viruses on the most deadly disease that we deal with, which is asthma. Why is it important, though, for asthmatics or patients with asthma? You can't say anything anymore. You can't say people don't take their medicine. You say they have to adhere. They don't adhere. I mean, but why is it important that people who have viral infections, people who have a history of asthma, get a flu vaccine?
Yes, it's very important that people with asthma get a flu vaccine, because you can think of asthma as inflammation in the lungs. And we know that with influenza or, the flu, it can wreak a lot of havoc in the lungs and create a lot of inflammation. And so if you have asthma, you're particularly at risk for complications from the flu, or for it triggering your asthma and worsening asthma exacerbations. And so it's really important that, patients with asthma get vaccinated.
Dr. Russ?
Oh, completely 100%. I'm actually going to speak as a patient with asthma who all of my life grew up calling herself asthmatic, but you're right, times do change and we have to stay up with them. Again, you want to make sure that you're giving yourself a fighting chance. There's so many things that we don't have control of over life, whether it be our water supply or our food, but making sure that we get vaccinations when we're eligible is definitely one of the steps we can take to protect ourselves.
And I think that people don't recognize the role that viruses play in morbidity and mortality with asthma. Certainly in young children, we see an awful lot of children with a particular virus called respiratory syncytial virus, maybe not more lethal than the flu and causing a certain type of asthma, but many of the adults who get into trouble, and there are 10 people who die every day from asthma, African American women with the largest mortality rates. A lot of those are people who have flu or who have other viruses, very, very similar. Here's one of the things that always puzzles me. Every year, somebody's trying to talk me into the fact that this year's flu is the worst ever, and this year's vaccine doesn't cover anything. So let's deal first of all. Are there flu epidemics that are worse than others? And are there certain types of flu that are worse than others? And how do we know how effective the flu vaccine is? Don't
Dr.
rush to
Ray.
answer the question, doctors.
Yes. So yes, there are many different sort of strains of flu, and what happens is you look at what strains were from the prior season, and then they try to make the vaccine for the upcoming season reflect what has been seen in the past. And this is very important because we know that flu, it's constantly changing. So it is, we do hear, well, this is the worst season, but we have to actually, continue to look at the different strains that are out there, which ones are, highly common, highly prevalent, and then sort of tweak the vaccine to reflect that. And so because the flu or influenza is constantly changing, that is why we have this, discussion year over year as to what's, worse.
Dr. Russ?
She said it all.
All right, well, that's a good answer. What about this year? How bad has the flu season been, and how effective is the vaccine?
So I'll just talk about what we're seeing here in Florida. I think we got spoiled last year. Everyone was masked up. We didn't even run our rapid flu test machine. We've definitely had a few patients come in already. We've had some staff members out, and they have tested positive for the flu. So it is out. It remains to be seen how effective the vaccine is. But what we like to mention is the flu vaccine is designed to help you to not die from the flu. It is possible to get the flu vaccine and still have the flu later on, but it's typically a milder case.
I think things have gotten so important about the flu that on most hospital staffs, maybe people don't know this, you can't practice unless you demonstrate that you've had a flu vaccination because of the morbidity associated with it. So I think we've established the importance of the flu. I gave some statistics out in the beginning of our program on the impact on the African American community. I think if you look at the number of deaths, we disproportionately die from every chronic disease and from every infection. I think it was Dick Gregory said that when America gets sick, African Americans get pneumonia. And so consequently, the flu is one of those things that can be prevented, very much like the coronavirus and COVID-19 infections, if you get the vaccination. I'd like to digress a little bit to talk about allergy and allergists. I'd like to digress a little bit to talk about allergy and allergists. I think that one of the things that is interesting to me, I've been an allergist probably longer than either of you have been alive. Maybe I shouldn't say that, but I've said it already. In any event, there are still so few allergists in the country. Dr. Wright, tell us about your journey into allergy and clinical immunology. What got you into the specialty?
Yes, so thank you for asking that question. I grew up with asthma and allergies, and I was really one of those kids who missed a lot of school because of asthma flares or asthma attacks. I was in the ER, constantly every, time I got caught a cold, I would, get an asthma exacerbation and end up in the ER. And so I had a very positive experience as far as getting care in the hospital and in the clinic. And so that inspired me to become a doctor. I did not know that there was a specialty of allergy and clinical immunology until I was actually in medical school. And so because I had been seen by my pediatrician primarily. And so once I found out about the specialty and how you can treat asthma and allergies, I thought, oh, this is right up up my alley and something I'm very passionate about. So that is, my journey. I am personally affected by asthma and allergies, and that's why I've chosen to pursue a career in the field.
So I'd like to thank both of you, Dr. Wright and Dr. Russ. And Dr. Russ, when we have our program on AIDS, I hope you will come back and discuss that with us as well. So I hope that our message to people is that the flu vaccine is every bit as important as the COVID-19 vaccine. I think Dr. Russ said it best, is that it's crazy if we can do something to prevent ourselves from getting sick and certainly to prevent ourselves from dying. And I think that's the position we're in whenever there's a good vaccine against a tough infection. So thank you very much. What a good discussion on the flu. Certainly, that should motivate you and not to forget to get your flu shot. And remember, if you're older, that you can get an enhanced flu shot. So ask for the special flu shot for people older than 65.
Hi, everybody. Happy holidays to you and your family. Today, we're going to talk about some ways to help make sure that as you celebrate your holidays, whether it's Christmas, Hanukkah, Kwanzaa, as you are celebrating, that you celebrate safely. So we're going to talk about 4 things today. We're going to talk about travel safety, some safety tips about decorations. We're going to talk about fire safety. And lastly, because it is the holiday season, we're going to talk about toys. All right, so let's start with travel. In terms of travel safety, we know that holidays are amongst the most deadliest time of year. And that's for a couple of reasons. There are a number of people on the road. Number 2, there is alcohol most likely involved in about a third of our accidents. So as you're celebrating and you're with your family and your friends, please consider having a designated driver, someone who is going to not have a drink about 2 to 3 hours prior to leaving. And that person will be in charge of making sure that everyone gets home safely. If you know someone in your family who has been drinking a little bit too much, this is the time where you can step in and say, hey, let me take you home, or let's have someone else take you home. Also, in terms of travel safety, as you're if you're flying or traveling by train or wherever there might be crowds, we want to make sure that you wear your mask inside and that you attempt to try to avoid crowds as much as possible. As you're traveling this holiday season, be mindful of what you're doing prior to your travel. If you're traveling home to see grandparents or people who have young children, you want to try to make sure that you limit your activity and exposure to coronavirus or to the flu virus about 3 to 5 days prior to your travel. That way, you will know if you start feeling ill that it might be a good idea for you to decline the invitation and to remain home. As you're traveling this holiday season, it's really important that you make sure to be mindful of your own symptoms and the symptoms of those around you. Safety decorating. As you are decorating your homes this holiday season and making them so beautiful, want to make sure that you pay attention to how you're decorating and what you're decorating your home with. If you're going to use lights, you want to make sure that the lights don't have any fray at the end of the lights, that there aren't any shortages in the light switches themselves. And if there's any bulbs that need to be replaced, that you replace them prior to placing them on the tree. We don't want any electrical fires accidentally starting. If you're using an artificial tree or a live tree, we want to make sure that you keep those away from any vents that are fireplaces, candles, anything that have the potential to cause damage or fires to the tree. You also want to make sure that if you're going to decorate with things like mistletoe, that you keep that away from children, because you want to make sure that your children don't accidentally take anything that could be poisonous. And lastly, as you're decorating, particularly if you have a live tree, you want that tree to stay alive. So a hack that I love is in my bowl where my tree is sitting, I put tons and tons of ice cubes with just a little bit of water to allow the ice cubes to slowly melt. And that allows my tree to remain vibrant and alive for a long period of time. Let's move on to fire safety because this is in this time of year with holidays, we see lots of fires. So we talked a little bit about keeping your trees away from candles, fireplaces, or heating vents. You also want to make sure that all of your other decorations that are flame or fire resistant. If you have an artificial tree, you want it to say fire resistant. Please make sure that as you light candles to have that lovely smell in your home, that you will not leave those candles unattended. Don't leave the candles on as you leave your home. Don't leave the candles on as you go to sleep at night. If you want candles close to your Christmas tree, make sure they're flameless candles. That way you have the light and the beauty of the candles, but not the danger of the fires. Finally, let's talk about toys. Now, this is the holiday season, so we love having toys. We want to make sure, though, that the toys are safe. Really pay attention to the ages on the toy packages. For children who are less than 3, no matter how smart you think those kids are, no matter how precocious those kids are, make sure that if they're under the age of 3, that there are no small parts that they can put in their mouth because that is a choking hazard. And no matter what, kids are kids, they're curious, and lots of them like to put things in their mouth. So we want to make sure that they are not toys that can cause choking for our babies who are less than 3. You also want to be mindful of toys that you're getting older kids, especially if they need to be plugged into an outlet, because you want to make sure that those kids really are old enough to understand how to plug a toy into the outlet safely. In terms of other toys, you want to make sure that you check with parents so that if you are going to buy a toy with wheels, a skateboard, a bicycle, a hoverboard, that to see if they already also have helmet or elbow pads or wrist pads. And consider, in addition to buying that toy with wheels, that you also buy the pads and the helmet so that that child can ride that wheeled toy safely. So during this holiday season, I hope you take these tips and think about what you're doing, who you're around, and how to enjoy this holiday season with your friends and family safely.
Thank you for watching today's edition of Wellness Watch. What a good discussion on the influenza. I hope that motivates you to go get your flu shot if you haven't already done so. And if you're older than 65, remember to ask for the enhanced flu shot. I also want to thank Dr. Donna Carey for warning us about the things that can happen around Christmas time. I know I've had some of these things happen to me. One of the things I might want to throw in is that, around Christmas time, you don't want to be around negative people. If you had a gathering last year and there was somebody negative or an argument broke out or you had an uncle who had a little bit too much to drink, it's not going to work again this year. You may want to set it up a little differently. But I want to take this opportunity to wish you the happiest of holidays from the Welcome Watch. Remember, health is your biggest asset. I'm Dr. Mike LeNoir.